Hi there, welcome to Ask the Chiropractor, your source for ultimate health, healing, and chiropractic-related information. I'm Dr. Adam Rodnick out of Commerce Township, Michigan. We're here with our returning guest, Dr. Nick Hartop out of Chesterfield.
Glad to be here.
Good to have you here. So I want to start, Doc, talking about an important court case that happened in the chiropractic profession a couple decades ago, the Wilk case.
Yes, back in 1976. It actually took 11 years of litigation to finally come to fruition, and actually came in our favor, which to me was a real big thing. But most people don't know about this because it kind of got pushed under the carpet. Now, they were supposed to bring out or make it public that, you know, part of the settlement was the medical profession was supposed to come public with this, that they were actually boycotting chiropractic. It was actually, this has been going on for, again, decades that they were doing this. And medical doctors were actually being taught and trained to, not just chiropractic, but other alternative medicines and other health care, because they wanted to basically you know, monopolize the healthcare fields. Why not? I mean, it's money. And well, you know, the old, again, Goliath, you know, the AMA was taken down by good old chiropractic, good old David.
Yeah.
And I just think that's just fantastic. And the attitudes we were talking earlier about of chiropractic, people understanding chiropractic has changed so much. Where when I first got into chiropractic 17 years ago, I would tell people I'm a chiropractor, and then we go, oh, one of those. And now I'd say I'm a chiropractor, and they go, oh, we love you. Oh, well, I just love chiropractic. And that was just in the past, like, say, 17 years. That has changed. Actually, just in the past 10 years, I've noticed a huge change in attitude towards it because they're understanding it better.
People are more interested now in natural health in general. More people are interested in yoga and exercising and, you know, not having as many fatty foods and sugars. People are really starting to open their eyes towards natural health care in general, and chiropractic is really a leader in the natural health care world.
Yes, and actually one of the myths of chiropractic is that once you go, you always have to go, which I find is very interesting when people tell that to me, because I have to take a deep breath because there's so many things that you have to keep going back to. Your dentist, you know, if you want to go to the gym and get big like Arnold, you have to continue to go back. It depends on how much you want to benefit from it. But they won't say that. They'll just say that about chiropractic. And I say I don't understand where they came from, but it's basically the Wilkes case right there. That's where it all started.
I tell people the same thing. It's very similar to any other thing. You know, once you start brushing your teeth, do they have to do it forever? Well, no one has to do that forever, but is it good for them? Absolutely. Right. And it's the same thing, like you said, with exercise or eating healthy. When someone starts, you know, cuts down their McDonald's and starts eating healthy foods, do they have to do it forever? Well, no, but is it good for them? Yeah.
Well, the vernacular has to change. It's do it. You know, you have to do it. No, you get to do it. You know,
that's a great example.
Yeah. So I usually, when people say, "Oh, you have to do it," no, you get to do it. You actually find out about it. It took me years to figure out this whole chiropractic thing. Even after I graduated, I still was, even all I went through, I still had questions. And when somebody sees you at a dinner party or some event, and they know nothing about it, they want to understand it right then. And it's like, come to my office and we can get started, but you're not going to be able to understand it in just, you know, a few minutes.
It took me years. Than most people think.
It's the philosophy behind it, and that's basically what chiropractic is: science, philosophy, and art. And the philosophy, if your philosophy isn't where it should be, then it's like putting a square peg in a round hole. It's just not going to work. So it's again, we were talking earlier about the different types of philosophy, inductive versus deductive reasoning. You know, inductive is basically going from the specific, I have a pain here, so you go right to that spot and then go to the general. Deductive reasoning, which is chiropractic or a homeopathic or holistic type of philosophy, is you go from the general to the specific. So sometimes if somebody would come into a chiropractor and say, you know, I have a pain here, a chiropractor may say, we'll go right to the neck, and they'll feel that, and they go, wait a minute, no, the pain's here. Yeah, but We're going to look at the whole thing.
So this is
first.
one of the big differences between homeopathy, naturopathy, and
Allopathy.
allopathy, which is the traditional medical model. And we see a big difference in the philosophy, but not a huge difference in our classes and our training, believe it or not. Most people, want to know the differences between, they think medical doctors and chiropractors are fighting all the time. And so in some cases that is the case, and that's more in the past. That's in the 70s and 80s where the AMA was really putting a lot of publication out there against chiropractors, trying to get people, just trying to keep their monopoly with the AMA rather than letting chiropractic and naturopathy and homeopathy into the field.
Mm-hmm.
But our training, if you look at our training itself, we had 4 years of graduate education in chiropractic school. Our first year and a half, 2 years, was all basic sciences. We had to take gastroenterology and genitourinary. We had to take spinal anatomy, general anatomy, all sorts of different physiology,
every
gross
ology you can
dissection.
imagine.
We had an entire year of dissecting cadavers where we went through the central nervous system, peripheral nervous system. We went through upper extremity, lower extremity, the works. We had basically very similar classes to medicine almost all the way through the program. In our last year and a half, we had obviously a lot more chiropractic technique where they had a lot more pharmacology. But in general, for all the basic sciences, for all the general anatomies and physiologies, it's the same. We learn the same information. It's the same body. The body has the same function, whether it's a chiropractor or a medical doctor that's looking at a person. The human body and the organs are the organs. We know what they are. They know what they are also.
Right.
So with the training the same, the big difference in the way we approach it is, again, the philosophy is the inductive versus the deductive reasoning. Chiropractic, we start with a premise. We have a philosophy saying that the body is a self-healing, self-regulating organism. And we do all of our research to prove that it's that self-healing, self-regulating organism and remove any interferences or pressures or speed bumps along its way so that it can heal. So we start with that philosophy and we go down from there. Where in medicine, they start with the other reasonings. They want to find out what they can do to treat or take care of different conditions and focus on them individually rather than one philosophy and building out. It's basically just the opposite model. And people think all the time that chiropractors and medical doctors have arguments and fight, and we tell them not to see medical doctor and they tell us not to see chiropractor. But now, modern day, we work very well with most people, everyone in the medical profession.
Right.
I have lots of medical doctors right in our area that I refer patients out to daily. They refer patients to me. We have a great relationship. And an example that I like to use about some of the differences between a chiropractor and a medical doctor is a fireman and a carpenter, right? You have a carpenter make a strong structure in the house. You want to make sure your structure is a great structure in the house, right?
Mm-hmm.
And that's the chiropractor we would say is like the carpenter. But when there's a fire in the house, you absolutely don't want to call the carpenter to take care of the fire. You want to call the fireman. And the fireman, he's going to come in, he's going to kick the door in, he's going to spray water all over, maybe the windows may break, all sorts of things, but that fire is going to be out. And that's exactly what medicine is best at. Crisis or emergency situations, life and death situations, they're going to put the fire out immediately, right? Diagnostics, amazing for diagnostics. But then who do you want to call after the fire's out? You want to call the carpenter to strengthen and fortify the house again. It's what we do as chiropractors, strengthen, fortify the structure and the immune system in the body. So we work really closely, and we want to work very closely with the medical profession.
It's like Thomas Edison said, the doctor of the future will give no medicine, but interest his patients in the care of the human frame and diet and the prevention and cause of disease. That's exactly what we do.
This is Thomas Edison, one of the greatest minds in
history.
In history, absolutely.
Yes.
Absolutely.
Yep.
So we have a little video that I'd like to show our audience. It's going to talk about maximum performance in athletics for children and adults through chiropractic care, whether it's from beginning stages of athletics in small children or professional athletes. So we're going to take a second here and we're going to roll the video. increases overall performance in general, especially not just with athletes, but with anybody. As we can maximize the performance of the spine and the nervous system, we maximize the performance of the body. And so I know that countless athletes that are in our country all see chiropractors. I take care of dozens of athletes in my office, and my clinics were the team chiropractor for the Saginaw Stings, a minor league football team. I happen to be also the team chiropractor for the Detroit Dark Angels, which is the women's professional football team. And most professional sports teams all have chiropractors now.
Oh yeah, yes, absolutely. In fact, was it Dr. Kogan? Dr. Kogan is for the Lions chiropractor.
Absolutely, absolutely.
But,
and you were just telling me that you have some ex-professional athletes that are patients of yours.
Yes, somebody from Blackhawks came to see me, and I still see him to this day. He's retired now, and I tell you, those hockey players.
Oh yeah, they have it worse than any of them.
And the interesting thing about that is that you watch them and when they get hit, you just go ooh, you know, like, and yet they get back up and they keep going, and you'll have a patient that just gets slightly bumped, you know, rear-ended, and they're crippled for a year. Well, whose fault is it? Well, the way the system is, you know, the person that hit them, which of course it wasn't good that they did that, you know, they're at fault there, but they shouldn't be liable for taking care of them for the rest of their life. Whose fault was it? The person that got injured didn't take care of themselves, and they were more susceptible to injury. So we have to take responsibility for ourselves. And again, these athletes are a good example of that. They take charge, and they condition themselves for these types of injuries.
And I take care of hundreds of children that are athletes, and we see children all the time. And even as children, what we see is if children don't take care of themselves, they end up with a lot more problems later as adults. You know, nobody lives in a bubble. The things we are constantly doing, kids are constantly, you know, falling off their bicycle, falling off the tricycle, rolling down a hill, fighting, wrestling, playing sports, wearing backpacks, hunched over like this, wearing a backpack.
Right.
Kids are constantly doing things to their body that are going to cause trauma and are going to cause damage, that if we don't do anything now as kids where they may not notice specific symptoms or warning signs, will lead to problems later on as adults. So I always tell people that, you know, I would hate to see their kids come in one day with a spine that looks like theirs does now.
Right.
They come to see me,
like
they have massive problems, and we don't want their kids to end up just like theirs are now. So by maintaining a healthy spine and nervous system, not only do we see kids with specific conditions, you know, I see a lot of kids that we're able to help with ear infections or allergies, even things like ADD, infantile colic, different things like that. We see a lot of autistic children in our office. We're able to help with a lot of different conditions, but we love to just help people maintain a healthy spine, a healthy nervous system for the children so that they have a higher immune system, they are able to perform at an optimal.
Yeah, yep, absolutely. Again, if we're proactive, and as opposed to being reactive, and that's kind of another difference between medicine and chiropractic, is that we're trying to be more proactive. What brings people in the office is usually a reactive.
Usually, unfortunately. But now, with the amount of excitement people have in our country about natural health care, a lot of people do come in just to come and say, you know, I want to keep my spine healthy, which is great, but we didn't used to see that. But the majority of people that come into us come in because they have a specific problem, they're reacting to that problem.
Right.
And then once we inform them on what we do and how we do it, which most people haven't heard, then they want to be proactive, and that's when they want to say, I want to get my kids checked, I want to get my family checked. Well,
when you're dealing with somebody that's subluxated, they're not able to think properly. I mean, because they're subluxated. They're not getting the nervous, like these charts right here in the upper cervical area. If this area, and this is the area which commonly goes out of place, if like the atlas goes out, the brain can't function at its optimum. So you're not making those good decisions. You find that when somebody is now not the subluxation free, they're able to make decisions better. Their body fights infection better. Their immune system is stronger. You know,
and they'll perform better, just like we said with the athletes. So you know, if their brainstem, their upper cervical area is working properly, they're going to have much better reflex. They're going to have much better fine motor skills. They're going to have a major difference in the way that they can. Their potential is to perform in the field. Not that necessarily, you know, come get adjustment and all of a sudden, you know, your high jump is 3 feet higher. But their potential is going to be greater.
Potentially, absolutely, because they're making split-second decisions. And if you're not at an optimum level, and that split second comes and goes, that makes a difference between a win and a loss.
Absolutely. And we even see people that come in, they just say they feel a little foggy, a little cloudy today, and after they get adjusted, all the times they say, wow, I feel like I'm breathing much easier, and I'm thinking much more clear.
You know, back I was in '95, I practiced in Winchester, Kentucky, and I had this gentleman that came in, and he was the state horseshoe champion. And he would come in and actually sign a little autograph and says, you know, I'm the state champion thanks to you. And I was like, wow, that's great. Because he would come in, you know, after a competition or before a competition, and it actually was kind of a lot of pressure on me because I was anxious to find out, you know, how you did, you know. And of course, you know, the fact that he put that kind of, you know, weight on, you know, the importance of a good functioning spine and good nervous system. You know, I was, again, more interested in making sure that he was at his optimum. So he pushed me to be, you know, better at what I do.
I actually have a similar person as a professional bowler, and he comes in before every single tournament. The day he's, you know, I know a lot of times right when he comes in, I say, you must have a tournament tomorrow, huh? He comes in every time before his tournament because just like horseshoes or bowling or golfing, these are one-sided sports. And we want to make sure we keep our body
in balance,
in normal symmetry, because they're doing one-sided activity the entire time. So I want to make sure everything is lined up.
And a lot of times I get, you know, like say bowlers, I get a lot of bowlers, and they say, well, what can I do? Well, you need to do something to the other side to balance that off, because it's all about balance and homeostasis. And when you're out of balance and homeostasis, it gives your body, you know, puts your body in a position or for injury, you know, or more susceptible for injury. And we had talked again earlier about call it biological continuum. It's basically just take a sheet of paper, draw a line. That is the biological continuum. Because going into the right, it's going to be going to optimum health. To the left, ultimate death. And again, it's your body's in constant flux. It's always going to go in a direction, whether you want to or not. It's going to go in a direction, and you have the choice and the power to decide on that direction. You know, you go fast foods, you know, you're a couch potato, you don't do a lot of activity, you're going in the wrong direction. I would rather be in all the way right before death and rather be going in the positive direction than being optimum going in the negative direction. Again, it's always the direction that you're going.
We want to keep ourselves going in the right direction. I like that example.
And again, like I say, where the mind goes, the body follows. So
That's
it all
right.
has to start with the mind.
That's a good segue into the most important facets of health. And so I want to talk with you a little bit about some of the facets of health. We'll get into them just for a few minutes here before we close our show.
Okay. I like to keep things real basic. I start off, you know, the essentials of good health. First one is breathing. You know, you have to, I see so many people that, especially women, they have a tendency to take these shallow breaths. You know, you don't even see them breathing, and they're not utilizing the lungs' total capacity. And they find that they are doing better. In fact, I have a friend of mine that's a patent attorney, and she's a 4-time cancer survivor. Wow. And she attributes a lot of her success through doing Qigong breathing. And this is a whole thing that she does, and she does it every morning because you need the oxygen, you know, to function properly. You can't survive without. So again, breathing, focusing on your breathing. There's all kinds of classes. You can go on the web and just find all kinds of information on it. Like Qigong is the name of it, and it's part of like a Tai Chi or yoga.
Doing proper breathing, even making sure we're moving our diaphragm up and down through its entire range of motion, helps to regulate our sympathetic, parasympathetic nervous system cycle. Right. You know, for stress in the body, we have what we call the fight or flight response. Sympathetic nervous system, when we have this fight or flight, meaning let's say a tiger's chasing after us, or let's say we're being threatened, someone's going to fight us, beat us up, take our wallet, we have this sympathetic response come in where immediately our heart rate increases, blood flows away from our digestive system and reproductive system and goes into our muscles. We have heart rate increases, blood pressure increases, pupils dilate, insulin levels change. And so that's the sympathetic response. But a lot of people are constantly not breathing right, and they're constantly getting that response because they got frustrated because they spilled a glass of milk or someone cut in front of them in a line. And so by keeping normal breathing helps to regulate our sympathetic, parasympathetic
Absolutely.
cycle.
Yep, keeps in a, also it balances, you know, the acidity, the body's acidity, right? We tend to be more acidic, and we need to be more alkaline. because when again, your body is more acidic, you're more prone to disease. Again, the next thing I like to talk about on the essentials of good health is water intake. And we had mentioned earlier about dehydration. Like 94% of Americans are dehydrated. And it's real simple. I give my patients a 20-ounce water bottle, and I calculate how much water they need, which is 50 ounces per 100 ounces of body weight. So basically, like a 150-pound man needs about 2 quarts of water a day. At my weight, I've simplified for my patients. Everyone wants simplicity is the key to success, is what I've always been told. And I have to drink 4.5 20-ounce bottles a day. So I just make sure I fill that up and keep track 4.5 times a day. And that way it's a no-brainer. I got too many other things to think about,
Right,
so
right.
you got to keep it simple. The next thing is diet, putting the right foods in our bodies. And things like this, Maximize Living, is many different programs are out this, and I really like this program right here. It has all kinds of great recipes and things. Talks about, like we had talked earlier, about sugar, the dangers of sugar. You have to be real conscious about the things that you're putting in your body. In fact, one thing I really like to do is for my patients is make a log, a diet log, and
Food log, yeah.
make it real simple. Again, you got to keep it simple. Take a piece of paper, fold it in half, then fold it again in half, and you just put one on one page, and then 2, and then just put everything that goes past your gums. And that way, you give that to your chiropractor or healthcare physician that's a nutritionist or somebody that's helping you with your diet, and that way they can make some changes as they see that they need to do. Exercise. Exercise is another point. Doing the right exercise. Some says, well, I am exercising. Well, maybe doing it improperly, and that's actually, I've seen that being, being in the military. A lot of things that we did wasn't exactly the best thing for us, like running around with 50-pound packs of rocks in the back and run until we pass out. That's it wasn't exactly the best exercise, but we were young and
proper exercise and proper motion is great for not only the body in general, for oxygenation of the muscle tissue, but it's great for the health of the joints themselves.
Absolutely, you need to have that stress on. We talk about stress as being a bad thing, but we do need to have certain stress on certain things. But again, the exercise is a key point, as well as what we had been talking about all along. It was like spinal health, proper spinal health. And like I say, those to me are the key essentials to health.
Absolutely. If we don't have the health of our nervous system, we don't have the health of anything. That is the most important thing. We want to make sure we keep our nervous system functioning at an optimum genetic potential as well as we can. And as chiropractors, that's what we do. That is our goal. That is the one thing we do, is we keep the spine and nervous system in proper alignment to keep it at its optimum genetic potential. So thank you again so much for joining us, Doc.
Thank you very much.
It's been a pleasure. So I'm Dr. Adam Rodnick out of Commerce Township. This has been Ask the Chiropractor. And remember that God gave you the gift of life, and what you do with that gift is your gift back to God. We'll see you next time.